name's Frey, an endocrinologist here at Thibodaux Regional. Our office is located in the endocrinology clinic on the 3rd floor of the Wellness Center here in Thibodaux, Louisiana. 1 in 5 adults have diabetes. Over 7 million Americans have diabetes and are unaware of it. It's a very important time right now to know we could all think of someone in our family or a friend that has been affected by this disease. The first thing we always talk about with patients, and the first topic here is diabetes education, okay? Lifestyle changes. Lifestyle changes including exercise, lifestyle changes including referrals to diabetes education along with a meeting with a dietitian. That is the absolute foundation of lifestyle changes for a diabetic. The changes that a diabetic can make, regardless of the amount of medication they're on, is very, very important in the treatment. I always tell my patients I want them on the least amount of diabetes medication they need. With regards to exercise, we recommend 150 minutes a week of exercise. 150 minutes a week, that's what the recommendation is. I always tell my patients, we discuss it. What is your plan? What is your plan to make this lifestyle change? And most of my patients that I see, they want to head back to the diabetes educators. They want to meet with the dietitian again because they get that benefit and they want a refresher. And I see it each day in clinic.
Hi, I'm Wendy Naquin. I'm a registered nurse and a certified diabetes care and education specialist at the Education Wellness Center of Thibodaux Regional. So the first question that was submitted is how many calories do I need to eat in a day as a diabetic? And so while calories are important in your meal plan, they're not the only factor that we're going to consider when we're developing a meal plan for you. So other things that we're going to consider, first, we recommend that you eat 3 meals a day and avoid skipping meals. So secondly, we want these meals to be timed. We want them to be 4 to 5 hours apart. If your meals are going to be more than 5 hours in length, then our registered dietitians are going to incorporate a snack into your meal plan. So the purpose of the snack is to prevent those long periods of time where we go without anything to eat or to drink. And then lastly, when you eat each meal, there's certain food groups that we want to be included on your plate. And so this will ensure that you have good balanced nutrition every day. And so for instance, at breakfast, for lunch, and supper, we want you to have a lean source of protein, some carbohydrate sources, fats, and then at lunch and supper, we're going to add those non-starchy vegetables. And then a snack would consist of a lean protein and a carbohydrate source. So when you follow a consistent time meal pattern, you're going to see more consistency in your blood glucose levels. Also, you're going to have much more energy to be able to participate in activities or organized exercise. Also, your diabetes medication is going to be much more effective if it's revolving around a meal, and you're going to have less side effects from your diabetes medication. So the next question that was submitted was, what is some new technology that is used today in the care of diabetes? And so what I'm seeing in working with diabetes patients, the new technology that we're seeing with more frequency is continuous glucose monitoring. It's also known as CGM. And so with a CGM, a sensor is inserted under the skin, on the arm or the abdomen, and that sensor is going to measure the glucose levels in your interstitial fluid within your body.
There are different options for these different CGMs, but they do essentially the same thing. They check their blood sugars. It's a device that checks blood sugars every 5 minutes. And it helps create a graph for a patient to continuously watch throughout the day. And it helps them to make those lifestyle changes, especially now with some of these devices being able to communicate with smart devices, including phones and watches. It makes the visits with me when patients come back very easy. The last thing we want to talk about, and the last topic I want to talk about today, is medications that have changed the way I practice, and it's changed the way I treat diabetes. There's medications, regardless of the A1C, that have proven efficacy. What does that mean? For my patients, my diabetics, an example would be a patient that had a history of a stroke, or a patient with a history of a heart attack, I have a medication that, for diabetes, multiple medications that have proven to reduce the risk of major adverse cardiovascular events, meaning reduce the risk of non-fatal MI, non-fatal stroke, and cardiovascular death. And with regards to the chronic kidney disease with these medications, I have diabetes medications that could help preserve renal function. And not to mention, with regards to heart failure, medications that, for those patients, can reduce the chance for hospitalizations for heart failure or cardiovascular deaths from heart failure.
And so our diabetes services here at Thibodaux Regional, they're structured to be able to provide you with the education and the information that you need to be able to manage your diabetes and incorporate the lifestyle changes that are needed so you can have better diabetes management. It is our goal that your diabetes management doesn't consume your whole life, but becomes one part of who you are as a person. So if you would like to speak to one of our staff members, you can call the Wellness Education Center at Thibodaux Regional at 985-493-4765.